Right, so presentations, lecture 7. So we're going to do some driving advice. Now, this is on the MLA framework. As a neurologist, I really deal with sort of neurological conditions that will affect driving, but I think a lot of the principles kind of underpin how the DVLA system works and the sort of thing that you need to know when you need to consider driving advice and medical recommendations. So driving is a complex learned skill, and it incorporates attention, limb function, visuospatial awareness, loss of awareness, which is the main thing that neurologists deal with, is a huge issue, particularly if it's unpredictable and unprovoked in terms of driving. Now, arguably, I would say that driving is probably the most risky thing that any of us do in a particular day, provided you're not a, fighter pilot or a spy. And if you are unable to control a car, which is a several ton machine which goes at high speeds, the risk to other people is considerable. And that's why it's one of the few things that we need to be sure that someone is safe from a medical point of view to do. And this is why it is a legal responsibility for people as licensed drivers to be open and honest with the DVLA about their medical status, health and ability to drive a car. So ultimately it is a driver's duty to tell the DVLA if they have any new notifiable illnesses or conditions. And it is our duty as doctors to diagnose someone and to give the appropriate recommendations for that person. There are a number of diseases that are a factor for driving. There is an extremely comprehensive website and PDF, which is really, really helpful, which I'll sort of reference throughout, which is worth looking at and just skimming through before your exam. And it's also worth remembering that the DVLA receives medical recommendations and information for doctors which allow them to then make decisions. And some conditions are quite structured, so things like epilepsy, seizures, heart conditions, there are quite sort of clear recommendations for different situations, but then there are always medical situations which are less predictable or more unusual, and those generally will have to go to a DVLA panel for a decision. The DVLA is a legal body, so they will make decisions which are then legally enforceable. And patients often ask us, could you put in a good word for me, or can you convince them otherwise? That is not your duty as a doctor when it comes to driving. You give the medical information to the DVLA when requested. You tell the patient what their duty is in terms of informing them. So epilepsy, diabetes, heart conditions, these have clear guidance, but there are 6 panels overall, and they then report directly to the Secretary of State. Cardiology, neurology, diabetes, vision, alcohol and drug misuse, and psychiatry. Now, I'm not going to talk much about alcohol and drug misuse, but interestingly, if you are considered to be an alcoholic, or if you are a chronic recreational drug user and are dependent, technically you are not legally able to drive. And I think we generally forget that. And the majority of people who are alcoholics or are dependent on recreational drugs, I don't think they are informed that they should not drive, but it makes a lot of sense. Vision, again, there are quite structured rules and guidance for ophthalmologists and opticians as to whether somebody can drive or can't. So your duty, so you need to assess a patient's symptoms, and you need to appraise whether you feel that would affect somebody's safety to drive. You then need to communicate that to the patient and tell them what they need to inform the DVLA of. In my experience, there are certain times where I deem somebody is not safe to drive. And I think, patients often misinterpret this. So we say, driving advice given. I think that that's misleading because it suggests that you have suggested something to a patient and they can take that or not. So I'm always quite clear. If somebody is unsafe to drive, I tell them, medically you are unsafe to drive. It is your legal duty to inform the DVLA of this. And that is what I say, and that is what I document. And I need to make it clear that this is a legal matter, and that I can't influence that. It is how it is. And so that's why I think the term medical driving advice can be misleading. So always be clear with the patient and then always document it. There are certain conditions where patients need to tell the DVLA they have it, but they can continue driving. And there are certain, if there are any changes that come about, then they would need to inform you and the DVLA. So Parkinson's disease, for example, if patients are not hallucinating, if their cognition is okay, their reaction times are good, and they don't have unpredictable freezing, they can drive. So I tell them, as you've been diagnosed with Parkinson's disease, you need to let the DVLA know that you've been diagnosed with that. These are what I've just mentioned, those are the particular things that we would have concerns about. So if any of those things come about, you can't drive and you need to let me and the DVLA know. And I will send a letter so that you can have that as guidance when you contact the DVLA. So that's what I tend to do. So there are two types of licenses. Group 1 is cars and motorbikes, and the majority of us have a Category 1 licence. This is a little bit more forgiving in terms of rules and regulations. And then Group 2, you've got large lorries, or what we in the north call a wagon, buses, and then some large vehicles which could be appropriate for things like the emergency services. It's worth noting that in terms of driving licence age, large lorries or wagons, you have to be 21 or above, and for bus drivers, you have to be 24 or above unless you have a specialist certificate. Group 2 licensing is much more stringent because if, for example, you have a bus full of passengers and somebody loses awareness, loses consciousness, the consequences of that would be much more significant in terms of injury or loss of life. So I'll mainly concentrate on loss of awareness. If somebody has a loss of awareness, generally that needs to be notified to the DVLA. If somebody is diagnosed with epilepsy or multiple unprovoked seizures, they generally can't drive 12 months until they're seizure-free. And then the DVLA will allow them to drive again, unless there's something compelling that would suggest that they will have further seizures or at high risk. So for example, an aggressive brain tumour. In that situation, the DVLA would probably say, you aren't safe to drive. Category 2 licence, so your wagon driver, you need to be 10 years seizure-free without epilepsy medication. So in essence, if somebody is diagnosed with epilepsy and they're a bus driver or a wagon driver, they cannot do that job anymore. So obviously that's a big issue, and patients often beg you, please don't, this is my livelihood. And it is really unfortunate and really sad, and it's, you need to be sympathetic, you need to understand what that means to somebody, but at the same time, you are responsible for their safety and the safety of everyone else on the road. They would put at risk if they drove. So you need to be both sympathetic but clear that this is a legal matter. An unprovoked first fit, it's generally 6 months, sometimes 12 months if there's an underlying factor for Category 1, 5 years for Category 2. And if it's a provoked seizure, generally for Category 1, if you're able to remove the provoking factor, then it's 6 months. So if, for example, somebody had a low sodium due to a medication they were taking, and you remove that medication and their sodium went up, you've removed the provoking factor, and after 6 months, generally that person could drive. Now, if it was alcohol or drug dependence, then that would flip to the alcohol and drug misuse factor. So if somebody continued to be dependent on alcohol or drugs, they couldn't drive because that's a continuing risk factor. And it's 5 years for provoked seizure for Category 2. So I'm just going to touch on a couple of other neurological conditions. There are hundreds and hundreds of medical conditions in the DVLA guidelines, so I can't talk about them all. Something that comes up quite a lot, if someone's been seizure-free for a long time, they might want to come off their epilepsy medications. Can be a bit problematic because we don't know whether they're having no seizures because they're having no seizures, or whether they're not having any seizures because they're well controlled on their medication. So therefore, the DVLA are clear that whilst you're reducing the medication, and for 6 months after stopping the medication, someone cannot drive. And if they are seizure-free after withdrawal, 6 months from withdrawal, they can have their Category 1 back. That's not the case for Category 2. Syncope, so that's your faints. If you are standing and you faint and you're prone to that, there are no issues because generally, well, I don't know of any car you have to stand in, but if you're sitting down, that generally wouldn't provoke a faint, you need to notify if you're a Category 2 driver. If you have a sitting faint, that suggests an underlying mechanism, possibly cardiac. So if you have a sitting faint or vasovagal event and a cause is found untreated, you can then drive again after 4 weeks. If a cause is found untreated and you're a Category 2 driver, you can drive again after 3 months. But if there's no cause found and this continues to happen, you can't drive because you can't predict that this won't happen again. And Parkinson's disease, I've mentioned, is a sort of chronic progressive condition, and the things that you need to be aware of: cognition, awareness, hallucinations, unpredictable freezing. And just touching on a few other conditions, dizziness or vertigo, you can't drive if you're still dizzy. So it's straightforward there. So if you have something like labyrinthitis, which is a sort of transient, horrible vertigo, which is thought to be viral, you can't drive until that's subsided. If you have a stroke, you can drive again Category 1 4 weeks afterwards, provided you don't have any deficits that would make you unsafe to drive. So that would be your limb function. So if you can't, manage the pedals and you're in an unadapted car, you obviously can't drive. But a significant thing for stroke is cognition and also neglect. So if you have visual neglect or tactile neglect, you can't appreciate some of the environment, and therefore you cannot see risks and manage the road. So you would not be able to drive in that condition. It's after 1 year for Category 2 after a stroke. Ongoing hallucination, visual inattention, like I've mentioned, or high-risk brain tumours, you can't drive either category. And if you have neuropathy, so you can't feel your feet very well, you can't drive an unadapted car. You may have to have hands-only controls. So in summary, the DVLA is a licensing authority which is under the government, which receives medical information from doctors. Doctors need to be clear with patients about what their duties are as drivers and what they need to inform the DVLA of, and they then make those decisions. Some of those decisions can be predicted because there are clear guidance. More unusual situations, you need to wait for the DVLA's opinion. Doctors can't convince or ask nicely the DVLA to change their minds. It is a legal decision, it is based on safety. You have to be clear about the DVLA guidance. You need to be clear that the patient is responsible to report any new diagnosis to the DVLA, and you need to give measures so that they're able to do that. So if the patient can't remember, you need to write down, this is the condition and these are the issues. You don't generally tell the DVLA on the patient's behalf, because that would be considered a breach of confidentiality. The patient is responsible to inform the DVLA. The exception is if the patient is unable or unwilling to notify the DVLA. So if, for example, you saw someone, you'd been very clear that they cannot drive because they have epilepsy and they're having ongoing seizures, and they came into clinic, they put their car keys on the table and said, well, I'm still driving. Now, that has happened to me before. You then have a legal obligation to inform the DVLA that the patient, despite very clear advice, is continuing to drive unsafely. In that situation, we generally recommend contacting your medical legal organisation like the MPS, because you are breaching confidentiality. But your obligation is for the safety of the person in front of you and of the road users. But you need to tell the patient, if you do not inform the DVLA, then I'm obligated to do so. You can't know if someone has not informed the DVLA but told you that they have. So I think you then end up getting tangled up in knots. I think you just need to be clear with patients, clear about their duties, and always document what you told patients and use the term, rather than advice, say, I've informed them of their duty that they cannot drive. And I think that will be very helpful. Now, the DVLA Licensing Agency Guide for Medical Professionals is online. It's publicly available, really, really helpful. And it might just be worth glancing down certain things like stroke, loss of awareness, cardiac events and vision in preparation for your exam. But I hope this overview has been helpful in giving you a sense of driving licensing for medical professionals in the UK. Thank you.